Hey, welcome to Socialism for All. Today's date is March 31st, 2022, and I just have a real quick COVID update for you. We've done a lot of coverage of the COVID-19 pandemic here on this channel. There's a playlist of those videos in the playlist tab if you want to look it up. But the last lengthy video that I did on COVID was on March 19. That was almost 2 hours of coverage of what is likely the upcoming spike or surge in cases that will be driven by the BA.2 variant of Omicron. Some epidemiologists, such as Eric Feigl-Ding, have strongly recommended that the WHO upgrade that to have its own Greek letter because it seems to be fairly distinct even from the previous BA.1 strain of Omicron. Nevertheless, that's what it is now. It's BA.2. It has been driving a huge surge in cases in Europe and in Asia, and it has been growing in prevalence in the United States. So one of the major takeaways from the March 19 video that I did on the channel is that experts were predicting that when BA.2 hit 50% of the overall COVID cases, in other words, when it had displaced the two or three major forms of BA.1, that's when we would start to see cases taking off again or a new surge beginning. So that has now happened, and probably within the next few weeks, we will start to see the beginnings of that surge. We don't know how high the overall cases are going to go. I mean, we had a peak of the first variant of Omicron, BA.1, in December into January. And basically the peak was around mid-January, January 15. It looks like we could have another one just about 3 months later, like in mid-April. April 15 is about 2 weeks from now. So not looking good for the pandemic is over crowd. Not at all. So on the screen, there are some charts and tables from the CDC's COVID tracker. And you can see BA.2 in the upper left graph. That is the pink, the light pink, and then the dark purple, those are the different strains of BA.1. Not hard to see that week after week, the pink BA.2 share has been increasing and increasing, and this past week, it has just surpassed 50%. In fact, surpassing expectations. What they're seeing in Europe is a lot of reinfections, people who had Omicron and are getting it again. So we could see that in the United States, particularly among people who are not boosted, not masking, things like that. And of course, Europe has a much greater proportion of people who are boosted. So as far as the dimensions of this in the United States, not looking promising. So down at the bottom of this, you see another graphic with a map of the United States divided into 10 regions. And that shows the proportions of BA.2 versus BA.1, BA.2 again being in pink. So in the Northeast, BA.2 nearly 75%, then down in more the mid-Atlantic region, it's about 45%. Other areas, the West Coast, are more like 55, 60%, and then, varying prevalence in the middle regions. So what does this mean? Let's go to a tweet. This is from Eric Feigl-Ding, epidemiologist and health economist, tweeting on March 29. Here is what is happening while cases currently plateau. So the COVID cases are currently plateauing. They have been coming down for several weeks since that mid-January spike of Omicron, and they're finally starting to level out and finding a bottom. We will see that in the wastewater graphs that we're going to look at in just a minute. But as Feigl-Ding explains, cases are currently plateauing, but BA.2 and BA.1 are crisscrossing. In other words, BA.1 is going below 50%, BA.2 is just going above 50%. So we are exactly at the red and green line crisscross point on the graph at the bottom. So the retweet from March 22nd says, as BA.2 grows, it will displace the older BA.1 original Omicron variant. You will not see a surge until the new variant overtakes the old. This is what just happened this week. This is why the US isn't surging overall yet, because BA.2 is still under 50%. Wait for the crisscross, that's when it plateaus and reverses. And of course, it takes a while to really start taking off. But if we look at that chart, the green line is the old outbreaks from BA.1 dying out. The red line is the new outbreaks starting, and the blue line is the overall cases. This is the pattern that has been seen in many of the European countries, and it's what we're expecting here in the United States. So I don't know what the exact timetable is. I was guessing 10 days ago that it would be about 2 to 3 weeks that we would start seeing significant movement by like mid-April or so. You know, if we look at this graph, the crisscross point is at about day 50 or so, 55 on their chart, and then you start seeing more significant things by like day 75. So that's about a 20-day gap, 3 weeks or so. Anyway, we'll see. But let's go to some stats, some data about what is actually going on with COVID right now. So cases are at a low, but there's something even better. Cases are a lagging indicator. In other words, they lag behind the actual biological reality by, I don't know, about a week, at least several days. What is more current and less lagging is wastewater monitoring. Now, not every county in the United States has good wastewater monitoring, but as part of public health, population health efforts, wastewater is monitored for all kinds of things, viruses, bacteria, just all kinds of stuff. And they do look for COVID in the sewage wastewater. And this is one of the quickest ways of detecting when there is COVID in a population. In other words, you don't have to wait for people to become symptomatic and then seek out a test and get the test results and all that kind of stuff. Just, you get COVID in your body, it multiplies, it comes out in your excretions. If it gets into the wastewater system, they can pick it up. So these are screenshots from a website called BioBot. The URL is biobot, biobot.io. So I've set all of the charts. You can set them to the entire pandemic or the last 6 months or the last 6 weeks so that we can get as much detail as possible. I've set them to the last 6 weeks. If you set them to the last 6 months, you can see that the wastewater COVID has been just going steadily down since the Omicron spike has been receding. What we can see here, zooming in, this is the entire country, and then we're going to get 2 more levels of breakdown, region and then by county, and that gets kind of interesting. But anyway, you can see here that looking at the last 6 weeks, it has bottomed out, just like Feigelding was talking about. You can see there's like a little bit of a bump, but basically it's plateauing at just over 100 copies per ml of sewage. The light blue line at the bottom is the cases, and the scale for the cases is along the right side of the y-axis. But again, that's more lagging compared to the sewage, so we're more interested in the sewage right now. Clearly, there has been a plateau for some time now, and the prediction is that that plateau is going to start climbing into a surge again, because we're no longer really dealing with BA.1, but we're now dealing with a predominance of BA.2, which is new to most people's immune systems, and reinfection is a very real possibility. So let's go to the next graphic. This is wastewater monitoring by region, showing the COVID level, and you get a breakdown here. The orange is the Northeast, basically Pennsylvania, New Jersey, all the way up to New York, and then New England. That area has the highest levels of COVID overall. Also, if you recall the CDC map of the country, that's the area with the highest levels of BA.2 relative to BA.1. So the other three are basically at about the same level. You have the West shown in blue, Midwest in purple, and South in pink or magenta. I'm sure some people are going to get really concerned about that. Anyway, continuing. We can also break this down by county. BioBot does not have every single county in the United States on here. I think that not all of them are monitored in this way, and then probably some of them that are don't get uploaded to this site. I don't know exactly how that works, but we can take a little limited tour of the country. So I want to stress that I am just here highlighting counties that are showing an increase. Why is that relevant though? And you might be saying, oh, he's not showing the ones that are decreasing. Yeah, because they're only decreasing temporarily. The thing that we know about COVID is it's contagious. So the counties that are showing decreasing COVID, that decrease is not contagious. The increase, however, is. So it makes sense to pay more attention to counties that are increasing because they have the capacity and potential to influence other counties which are not currently increasing, but it could spread to them. So anyway, starting out in the west, here's Clark County, Nevada. This is where Las Vegas is, and a modest increase. You see that there's a wavy line there. You see that in a number of counties. Actually, some of the ones that I have excluded from this little brief tour of the country have been doing this kind of wavy thing. It's sort of plateauing, but with bumps. Anyway, Clark County has been on the increase now for about 2 weeks. Now, moving east to Arapahoe County, Colorado. This is near to Denver. We're missing the most recent data here. It's just kind of a snapshot. However, clear increase from about the beginning of March up until about a week ago. Pretty sharp increase. Now, moving east and south again, we're going to kind of go up the east coast. Here is Hillsborough County, Florida. This includes Tampa. Again, kind of a plateau early March, and then that has been increasing for at least the last, I'd say, 2.5 weeks. Moving up the coast, Arlington County, Virginia, had its low point at the end of February, has been increasing ever since. This section of Virginia is the part that is just adjacent to, just west of Washington, D.C., is basically part of the D.C. metro area. So I couldn't find data for D.C. itself, but if this is at all indicative of what's going on in D.C., then that Jen Psaki COVID case is not all that unusual. So anyway, this is Arlington County specifically. However, several other counties in that northeast Maryland-facing area of Virginia are also showing similar increases just like this one. Moving a little bit north, here's Chester County, Pennsylvania. I think that this is one county west of the county that has Philadelphia, so it is southeast Pennsylvania. Again, showing a consistent increase for about 3 weeks now. Moving northeast again, Essex County, New Jersey. This is not directly adjacent to New York City. Again, it's like another county or so over. However, remember that New Jersey is a very densely populated state in its own right. A lot of people there. And again, consistent increase in the COVID wastewater for about 3 weeks, maybe even 4 weeks. Moving northeast again, here's Fairfield County, Connecticut. Had kind of a big plateau from mid-February to early to mid-March, then a sharp increase, now plateauing again. We'll see what happens there. But moving north of Connecticut, Hampshire County, Massachusetts, is in that part of Massachusetts which is right above Connecticut. And again, steady increase there for 2 weeks after a long plateau. And finally, our most northeastern point in this little tour, Essex County, Massachusetts. This is north of Boston. Similar pattern as the last two, long plateau in late February through mid-March, and then in this case, a sharp increase. We're missing the last week of data, but the numbers are pretty high on this one. If you recall, the average was about 100 copies per milliliter. It's almost 300 in this area. And in fact, unless the trajectory has changed, that missing week, it's probably up to at least 400 or 500 by now. Though again, these curves do wobble, many of them, so we can't be 100% sure about that. I look forward to getting some new data, maybe next week, maybe the week after. So, to sum up, we have some major cities: Boston, the New York City area, Philadelphia, Washington, D.C., Tampa, Denver, Las Vegas, showing pretty significant increases, and I think that there are others that I didn't highlight here. There are some counties that are going up significantly in Texas, for example, but I'll leave you something to look up on your own on biobot.io. So anyway, that is the quick COVID update for this week. The dam has not broken yet, but BA.2 has passed that 50% mark, and we are starting to see climbing again in the COVID wastewater monitoring charts after a long period of falling. So BA1 is basically over, BA2 just starting up, and again, if you're not looking at the wastewater charts, you're probably not seeing it. That is our earliest detection method. That and the Yankee Candle reviews on Amazon that complain of having no smell, but it's a whole other story. But yeah, stay alert, stay aware, keep masking, get boosted if you haven't already. See if your county is featured on BioBot and keep an eye on that, or at least a nearby county if your county isn't on there. And keep an eye on Socialism for All. This channel will have more updates as there are new developments. Otherwise, what do you think? Leave a question or comment below. We'll continue the discussion there. And thanks for watching. Thanks also to the patrons whose names are on the screen. If you'd like to get your name on the screen, head to patreon.com/socialismforall. You can sign up for as little as $2 a month or more, whatever you see fit. Every donation is encouraging. They're also materially helpful. So I really appreciate the patrons a lot. If you like this channel, thank me, of course, because I'm the one actually recording and uploading this stuff, but also thank a patron because their support has allowed me to spend a lot more time on this than I would have been able to do without their support. It's a very real thing. We don't want to take it for granted. They say that you don't know what you have till it's gone, but there are ways around that, such as imagining what your life would be like without things that you enjoy and appreciate, and I do hope that you enjoy and appreciate this channel. Otherwise, liking, sharing, subscribing, and commenting on this channel all help to boost it in the YouTube algorithm. It helps more people to see this content, which everybody appreciates in the end. The whole point of this channel is we're trying to make information about socialism more accessible, easier to find, easier to stumble across, and your engagement and support help out with that. So there's me, there's the patrons, and then there's everybody in this community who's been engaging with it, and all of us have a part in helping more and more people to find this information and to use it in their lives. Thanks again for listening, and we will catch you in the next video.